study nucleo in cardiopulmonary disease. I'm so glad to be here, and now I will talk about this article produced in this research project called A Study of Atrial Fibrillation under an Epidemiological Perspective, linked to the risk factors involved. So, just a minute. The present in Santa Maria University Center from Brazil by me, Bianca Caldeira Leite, Arthur Moreno de Andrade Vasconcelos, Cibele Lorena Fernandes Guerra, Vitória Sampaio Moreira, Júlia Thaís Cruz, Ubiraide de Andrade Isidório e Marta Lígia Vieira Melo. The keywords are epidemiology, risk factors, and atrial fibrillation. So to start, we have to understand the atrial heart has 4 chambers, the right and the left atrial, and the right and the left ventricles. So the normal heartbeat starts in the right atrium. The sinoatrial node sends an electrical sign that travels through the heart muscle. First, this electrical sign passes from the right atrium to the left atria by internodal fibers. So the atria can contract and pump the blood from the atria to the ventricles. Then these electrical signs arrives at atrioventricular node and pass to the ventricles by the Rehes bundle and Purkinje fibers. So when the ventricles contract, the blood is pumped to our lungs and to the rest of our body. And here we have to see that in atrial fibrillations, this electrical sign that should be generated in sinoatrial node is replaced by ectopic stimuli generated in other specialized cells from the heart muscle, so which leads a rapid and irregular heartbeat. Here in the electrocardiogram, we can notice the absence of the P wave and irregular intervals between the KRS complex. So we can define the atrial fibrillations as a dysfunction of the heart rhythm caused by a right frequency and disordered stability of the atria that generates an irregularity in the excitatory pattern of the ventricles. Common causes of atrial fibrillation are aortic stasis, heart failure, heart attack, and here we will also to analyze the risk factors involved in this disease, because some conditions as smoking, alcohol consumption, hypertension, diabetes, sedentary lifestyle, and obesity, age, and sex can promote some structural changes in the atria that can predispose to atrial fibrillations. Some people can feel palpitations, chest pain, but other people do not have any symptoms. So our objectives are to address the epidemiology and risk factors of atrial fibrillation in order to synthesize data on the incidence of this disease, in addition to linking it with exposure to external factors such as alcohol and tobacco, with special groups like pregnant women, athletes, and the elderly, and pre-existing comorbidities like diabetes mellitus. About our research methodology, we made an integrative literature review. The central hypothesis was how does the incidence of atrial fibrillation in the most diverse groups and how two epigenetic factors can determine the manifestation of this disease. We used descriptors in health science, epidemiology, atrial fibrillation, and risk factors. They were crossed by Boolean operator, and in the database Scientific Electronic Library, SciELO, and National Library of Medicine. In PubMed, we have 306 results. In SciELO, we have 23 results. Of these, applying our inclusion and exclusion criteria, and after reading those articles, 18 literatures were used in this research. Our inclusion criteria are articles of systematic review and meta-analysis, clinical trials, cohort studies published in English and Portuguese and reference in between 2016 and 2021. Our exclusion criteria are duplicate studies that were excluded by using the Mendeley 2 monographs, letters to the editor, and incomplete tests. So finally, our results and discussions about the general prevalence. We found a research of the global burden of disease that shows that atrial fibrillation is the most common sustaining arrhythmia in all emergency service in the world, affecting an average of 2.5% to 3.2% of the population in all countries on different continents. And we also brought here that the highest prevalence rates of atrial fibrillations are found in developed countries, especially those in North America, probably because the sedentary lifestyle and high consumption of fast foods and ultra-processed foods. Now as for the prevalence of gender, it was observed that the gender relevance in the development of this disease is discussable, except in people who have the age in over 75 years, whose the risk will be higher in women. A cohort study from the Framingham Heart Study shows that the men have a higher risk of developing atrial fibrillations compared to women. And about the special groups, it was noticed that the risk of atrial fibrillations in athletes, especially male and with age under 60 years, is higher than in the general population. When we talk about special groups, we are talking about athletes, pregnant, and the elderly. In the elderly, the risk of atrial fibrillations is higher by the aging process itself. We also find that this risk is higher in athletes. And about the pregnancy, we know that the pregnancy alone, it's already a state of hypercoagulability. But here we found that the pregnancy is only a risk factor to atrial fibrillation when the woman already has some structural heart disease. And among women with known atrial fibrillations, the incidence of recurrent episodes of this disease in the pregnancy was 39.2%. Now, talking about the risk factors involved in the atrial fibrillations, starting with diabetes mellitus, we noticed that diabetes mellitus may increase the relative risk of atrial fibrillation by 28%. This is because the diabetes can increase the glycolate products and causing atrial fibrosis, which can predispose to atrial remodeling and some changes, some structural or electrical changes in the atrial that can cause a delay in interatrial conductions and predisposing to atrial fibrillations. About the chronic alcohol consumptions, the high alcohol consumption increased the risk of atrial fibrillations by an average of 62% for both gender, while moderate consumption of alcohol increased the risk of atrial fibrillation in men 48%, but not in women. Here, the alcohol consumption is classified as low, moderate, and higher. Low when is it of 10 to 12 grams of alcohol by day. Moderate when is it of 20 to 24 grams of alcohol by day. And higher when is it of 30 to 36% to 36 grams for alcohol by day. The studies shows that the chronic alcohol consumption can promote a prolongs in some intervals in the electrocardiogram, like the KRS complex and the KT and PR intervals, which also can predispose to atrial fibrillations. Now, talking about chronic smokers, that are people who smokes 10 smokers per day or more, there was an increased risk of atrial fibrillations in 33%. Here, we found at literature that the nicotine can alter the plasma concentrations of catecholamines like dopamine, norepinephrine, and adrenaline, which can cause a high frequency, cardiac frequency, and increase the cardiac debit, which also can predispose to atrial fibrillation. And finally, the obesity that was defined by Bosmati index higher 30 kilos per square meter, it's associated with an increased risk of atrial fibrillations about 51% compared to the non-obese cohort, especially because the obesity index are increasing a lot about for the sedentary lifestyle, and as already told, the high consumption of ultra-processed foods. Now, our final considerations. As for epidemiology, we can notice that atrial fibrillation is the most common sustaining arrhythmia in all countries on different continents. And about the gender prevalence, there are contradictions in the literature. In relation to risk factors, it has become clear that the diabetes mellitus, the chronic use of alcohol, smoking, and obesity are directly linked to atrial fibrillation, promoting considerable increasing in the risk of these manifestations. And now about our difficulties and limitations in this study. There was a lack of recent articles showing the epidemiology of atrial fibrillation. And furthermore, the relevance of the genetic influence here was not analyzed, especially when is it associated with the risk factors involved in the atrial fibrillation. So I would like to thank the other authors of this research, especially our advisor, Marta Liges, for all the support and patience during the producing of this article, as well to the study nucleus of cardiopulmonary disease and the Santa Maria University Center for the financial support needed to carry out and to present this article here today. And I also would like to thank the conference by the invitation. I'm so glad to be here and for the opportunity to be here. And this is our references.
Thank you very much, Dr. Bianca Caldeira. That's a wonderful and a very excellent